Good day everyone, my name is Rico Martin Castillion from BSN 1K, and today I am going to demonstrate the lateral and posterior turn demonstration of the chest. So before we begin performing, we will of course perform proper hygiene, and it is also important for us to prepare all the equipments needed for the assessment. So the next step that we are going to proceed is the assessment proper. So I will going to introduce myself to the client and verify some of his identity and provide privacy and explain what we are going to do with the assessment. So good morning sir, I am Rico Martin Castillion, your student nurse for today. So may I know your name?
My name is Jacob Mark Almagin.
And your age sir?
And I am 19 years old.
So I may provide privacy for this assessment. So since I'm here to assess your posterior chest today, why do we have to do this, sir? So if there are any abnormalities in your posterior chest, such as lesions or masses, irregularities in the size or shape of your chest, we need to take note of that in order to avoid further complications. So do you have any clarifications or questions, sir?
None so far.
Good. So the next thing that we are going to do here is to proceed with the first procedure, which what we called inspection. But before that, we are gonna ask our patient to remove the clothes so that we can check the posterior part of the chest. So sir, if it's okay to remove your clothes.
Okay, it's okay.
Turn around. So the first thing that we are gonna inspect here is the color of the chest. So as I saw or expected here, I can see it from the light to deep brown, which is the normal finding. So if you can see abnormal finding, which indicates anemia, cyanosis, which is the bluish one, which indicates from any result of hypoxia, or the redness may indicate allergic reaction. So we need to take note any of these. So next is I am going to inspect here the scapula of our patient. So as I observe here, it is symmetric, so it is a normal finding. So if there is any spinous process is deviate laterally in the thoracic area, that indicates a scoliosis. So the next thing that we are going to check here is to inspect the use of accessory muscles while breathing. So our patient here is breathing, he doesn't use accessory muscles to assist the breathing. So the next thing that we are gonna do here is the palpation. So as we palpate, is what are we going to palpate? We are going to palpate the tactile firmitus. So as we palpate the firmitus, it is symmetric and it is easily to indicate which is good. So if there is any increasing crepitus, we have a problem on the lung tissue, which we call pneumonia. So the next thing that we are going to palpate is the tenderness sensation of crepitus as well as the masses lesions. So sir, tell me if you feel any pain.
Okay.
Do you feel any pain, sir?
No, I don't feel any pain at all.
Good. Okay. So there are no tenderness or pain, which is good, and there are no unusual sensation. Also, there are no crepitus and no lesion and no masses, as well as we observe any soreness in the crepitus. It can be palpated or it can be indicated for those areas that has congestion. So if there are any masses indicate, so we need to take note of it. So the next thing that we are going to palpate is the diaphragmatic excursion. So here on the chest, so I am gonna ask my patient to deep breathly. So sir, can you please deep breathly? Okay. So as I'm observing this, my thumbs move outward and symmetric from the middle line, and that is a normal finding, which is good. So the abnormal findings for this is there's any asymmetric movement or decrease on chest expansion. So the next thing that we are going to do is the percussion. So we are going to percuss the tone at posterior intercostal spaces or comparing bilaterally. Okay, sir. So when I am palpating these areas, I can hear a resonance sound on the lung tissue and tympani sound over the stomach here on the flatness. So on the muscles and bones of the patient, so the next procedure that we are going to do is the auscultation. So here we are going to take the posterior breath sound. So sir, can you please deep breathe to check if there is some abnormal findings here? Okay, sir. Okay, so when I am observing here, there are no wheezing or crackle sound or any other advantages. So his breath sound, that is good. If there is any abnormalities in his breath sound and increase of breath sound, we need to take note of those. So the next thing that we are going to do is to auscultate the tone or voice effect of patient's breath. So here we are going to ask our patient to say 99 and while auscultate the posterior part of the chest in repetition. So sir, can you please say 99?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. So when I am auscultating here, I hear a muffled and indistinct voice, which is good result. So if there's any increase in what we call any abnormalities in the sound of our patient here, and if is there any clear sound as we check here. For the next is we have to check the egophony. So here, sir, can you please say a long E for me as I'm going to auscultate your posterior chest?
Okay. E. 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 E.
Okay. So I asked my patient and observed his voice. So I heard a muffled and a long E sound. So if the patient says E and if it sounds like a letter A, then it is an abnormal findings. So next is we are going to check here the whispered pectorally key, and this is we are going to ask our patient to whisper 99 in a whisper manner. Sir, can you say 99 in a whisper manner while I auscultate your back?
Yes.
Okay, sir. Okay, so while auscultating my patient's posterior back in terms of whisper, I heard a faintly and a distinctive voice, which is good findings. So if we can observe, so we can describe usual clear transmission of whispered words. Therefore, it is abnormal. So all normalities that we indicate, which is may result for pulmonary consolidation. So the next thing that we are going to do is to take note and describe if the patient has a cough or sputum. So since in my patient's case, he doesn't have any cough, and so we are going to do the next is the hand washing part. Then I am going to assess my patient with care and document their findings. So sir, can you please now wear your clothes while I am going to do the hand hygiene. Alright, so we are done with this physical examination. Thank you very much, sir, for your cooperation and time.
Thank you.